You got pain? Let me introduce you to some rascals that can help. So, hi, I'm Dr. Patrick Jones from the Homegrown Herbalist School of Botanical Medicine, and we're going to be talking about pain today and some herbs that I use all the time um, that really can have a tremendous impact. So, let's get started. So, first of all, here's a great quote from C.S. Lewis. It says, "Pain insists on being attended to. God whispers to us in our pleasures, speaks in our conscience, but shouts in our pains. It's his megaphone to rouse a deaf world." And that's really true. I mean, pain is really important. Pain's our friend uh, because we live in kind of a dangerous world. There's fire and sharp things and ice cream trucks that can run us over. I mean, there's all kinds of bad stuff that can happen. And pain is the body's way of telling us that, you're in danger, right? Quit touching that. And so it really is an extraordinarily important mechanism. And, there are some conditions where people don't have pain. One is called CIPA, C-I-P-A, and another one is leprosy. And in both of those conditions, the nerves actually are dysfunctional for pain. You know, um, People with SIPA have a lifespan of about 25 years because they can't perceive anything. They can't perceive heat or cut or pain or anything. And so, they die of hypothermia, standing on their porch. They die from infections, all kinds of things because they can't perceive the warning signs. Leprosy is the same thing. I mean, it's a different disease, but it has the same effect. You, people that have leprosy lose their fingers and things. It's not because leprosy makes your fingers fall off. It's because leprosy makes it so that you can't feel things, and you turn a key in your lock and you don't know when to stop. And the next thing you know, you've crushed tissue and damaged tissue, and you don't feel that. You don't know, and then it gets infected. You don't feel that, and you don't know. And by the time um, you realize there's a problem, it's too late to fix it, right? And so pain is actually a really good thing. But sometimes you can have too much of a good thing, right? Sometimes the body, having done us the favor of telling us that something bad is happening, it now, decides that it needs to tell us lots more about it, and we just have more pain than we need. And so we want to do some things about that. So let's talk about some plants. And all of these plants are very easy to access in most parts of the world, in fact. Um, and we're just going to go through one by one and kind of introduce you to some of these rascals. And like I said, these are things I use all the time. I'm a veterinarian and I'm also a naturopath. And, I see animals that have a lot of pain issues. I talk to people that have a lot of pain issues. And these are some of my kind of go to weeds to grab, when I want to help somebody. So let's have a look. The first one is skullcap. Um, and this is Scutularia lateriflora. It has a lot of other names. They call it hoodwort. They call it mad dog skullcap or mad dogweed or madweed. Um, it's not the same as Chinese skullcap. That's a different plant. Same genus, but it's a different species. We're talking about the American one. And it grows in Europe too. So the parts we use are the aerial parts. Um, and skullcap is in the mint family. But interestingly, most mints are very aromatic, and they smell nice and minty or nice and something. Oregano's a mint too. It's not minty, but it smells like things, right? Most of the mints have a lot of essential oils, are very aromatic. Skullcap, one of the ways that I identify skullcap is it has the structure of a mint in that it has square stems and the leaves come off opposite and alternate. So you can see in this old vintage picture, you got two leaves coming off east and west, and then you got two north and south, and then you got two east and west, and then you got two north and south. And that's the pattern for mint family plants. So if they have both of those, if they have the square stem and they have that alternating and opposite leaf structure, it's a mint, right? But most of them have a strong aromatic, uh, aroma, and they taste like something. Skullcap doesn't taste like anything, and it doesn't smell like anything. So if it's a mint and it's not bragging about it, then it's skullcap, okay? So how do it's easy to grow. It's a mint, and all of the mints are easy to grow. In fact, you need to be a little careful where you put your mints, because they'll take over your whole property. Very, very aggressive, happy, busy folks, and they spread by root runners and by seed, and so they're just, very, very sure you didn't mean to leave them in that bed, right? And so you need to sort of manage them. A lot of good ways to do that. You can put them in a bed of some kind. You can put them in a big pot. You can bury a kiddie pool and fill it with dirt and plant them in that so that root runners can't get through the plastic. There's a lot of ways you can do it. The whole plant's the medicine. Anything above the ground's the medicine. That's what we always mean by aerial parts when we say aerial parts. And the best time to harvest skullcap is when it's in bloom. So when the flowers come on, you cut off like the top third of the plant or so, and there you go. You got your skullcap. So skullcap, like all the mints, everybody in that Lamiaceae family has an affinity for the nervous system or for nerves. They also tend to kill things. That's sort of the mint family mission statement, right? They got together and they said, we're the mint family, and we like to do something to your nerves, and we like to kill things. And so anyway, all their neighbors moved away when they hung that on their wall. But anyway, they kill all kinds of things. Some of them kill bacteria, some of them kill viruses, some of them are antifungal, some of them are anti-everything. Skullcap's antimicrobial properties are almost nothing. No, that's not what we use it for. And it because, again, it doesn't have those essential oils. The essential oils are really the thing that are dangerous to the bugs. And skullcap just doesn't have them, and so that's why it's not as good. But so on the spectrum of antimicrobial mints, it's way on this end of nothing, right? You got oregano and lavender on this end that kill everybody, right? But on the calming nerve spectrum in the mint family, skullcap is the rock star. I mean, it is the most powerful one of all. And it's very useful for all kinds of issues that benefit from calming. So you can use it for insomnia. You can use it for anxiety and panic attacks, but you can also use it. They used to use it. The reason they call it mad dog skullcap is because they used to use it for rabies, and I don't think it killed the virus or anything, but I think it calmed the crazy dog down, or the crazy person, unfortunately, in those days. And so, this is back in the 1700s, 1600s, they were using it for skullcap or for rabies. But anyway, it's very good for pain internally and topically, particularly if it's nerve pain. If it's like a pinched nerve or an aggravated nerve, skullcap is the bomb for that. And you can use it internally. You can make a tea, you can make a tincture and take it internally, you can put it in capsules if you want. I usually use it as a tincture. And I often use it as a tincture topically. A lot of tinctures are very, very effective if you put them on topically on your skin. And so, if you have, a pinched nerve, or if you have joint pain, arthritis, it doesn't matter what kind of pain it is, and you put some skullcap on that topically, it often will numb those nerves and calm them down, tell them to have a nap and quit screaming at you, and that's how it fixes the pain. It does have a few volatile oils in it. So if you are going to make a tea, if you're going to heat it up, put a lid on it. And that's true with any of the mints, especially the ones that smell pretty. You got to put a lid on it while you're making the tea. And when you make a tea, there's no reason to boil the herb long term. Boil some water, take it off the stove, throw the plants in there, put a lid on it. Don't boil the herbs. The hot water is plenty good enough, especially if you're using a dry powder. If you're using like tree bark and roots and stuff, then yeah, you got to boil the herbs. That's called a decoction, right? But the way I do everything is I dry it and powder it and grind it. Just grind up the dried herbs in a blender, and then use the powder to make your teas. And then it just takes a minute for that water. As soon as it's cool enough to drink, it's ready. All right, so that's skullcap. Let's talk about hops. Cumulus lupulus. They also call it zarza. There's a couple of different species. Cumulus lupulus is the one we use the most. It's the one most often used in the trade. But there's Cumulus americanus and Cumulus neomexicana. There's a couple of others that are also good. So hops is really easy to grow. It's a vine. And it really likes to have something to climb. And what I do is I get a wire. If you're out west, you'll know what I'm talking about. You know what a cattle panel is? It's like a wire fence panel that you can buy at the feed store. I don't know if they have any of those in Manhattan, but we have them in Idaho. And anyway, feed stores I'm talking about. Anyway, it's just a wire panel, and they use them for fencing. And I just make an arch out of a couple of them, tie them together and make an arch. And then, plant the hops on either side, and it grows right over and makes this pretty little canopy, and it's real thick and nice. Or you can plant it next to a phone pole or next to a tree or next to whatever, something it can climb, a fence, right? It's a vine. And then it likes to have full sun or partial sun at least. It likes the soil to be a little neutral or acidic, although our soil is pretty alkaline here in Idaho where I live, and it grows happy fine. What it doesn't like is to have its feet wet for very long. So it needs pretty good draining soil. And if your soil's got a lot of clay in it and holds the water too well, you might want to amend that soil a little bit. So the medicine on hops is the strobile. And this is the strobile here. These they look sort of like little pine cones, but they're not. They're soft and green. And they start to form in the early summer, late spring. But you don't want to harvest them until like really late summer, early fall, even maybe late September, kind of. What'll happen is they'll start changing from being green to having sort of a yellowish tint. They actually get a yellow powder on them. And that's when you want to harvest them. They also start smelling different. All summer long, they smell like green veggie stuff, And then in the late summer, early fall, they start smelling like hops. It's a more aromatic, richer kind of a smell. Don't harvest them the first year because, the plant's working too hard trying to make a good root system and stuff. But after that, harvest them every year. The easiest way to harvest them is to cut some of the vines off and then pull them off, let them dry even and then pull them off, rather than trying to pull them off the living guy that's climbing up so high. So hops, as you probably know, has been used for making beer forever. They've been making beer out of it since like the 8th century. And it has some benefits in beer. One is that it's an antimicrobial. Hops kills bacteria, so it keeps the beer from spoiling until it turns into alcohol and is a preservative itself. So that's good. It also has some calming, sort of sedating effects of its own. So that's, worth having in some beer, I guess, if you like beer. It also has tons of estrogen in it. And I don't know if that's why they're putting it in the beer, but it does make for fewer broken pool cues in the bar, Don't tell the beer drinkers that. They'll be mad. They think it's manly to drink beer, but hops is chock full of phytoestrogens. And so, anyway, so hops is calming. Hops is, it's good you can use it for anxiety. You can use it for insomnia, all the calming stuff. Very similar to skullcap, but it operates in a completely different way. The receptors it binds to are completely different. In fact, the receptors it binds to are the same receptors that marijuana binds to. And it doesn't have any of the THC, which is the chemical in marijuana that makes you high and makes it illegal. But it's in the same family. It's in the Cannabaceae family. So cannabis and hops are the only two genera in that family. And there aren't that many species in either genus. But so anyway, cannabis is over in this genus, and Cumulus is the hops genus. But they have very similar properties. They're cousins, and so the hops has some of the calming, sort of sedating properties without having the intoxicating, get you high properties that marijuana has. But it does attach to those same cannabinoid receptors in your cells that are the guys that decide what hurts and what doesn't. They are very, very influential and important in managing pain. CBD oil has that too, And so people that are using medical marijuana for pain or are using CBD oil for pain could be using hops just as well. And I got to tell you, I discovered this completely by accident. I was using hops. I've used it for gut things. It's really good for calming guts. It's good for enteritis. Anything wrong with your guts, hops internally is fantastic. A little hops tea, a little hops tincture will fix a bellyache, fix diarrhea, fix enteritis and colitis and all those things. It just makes your guts feel better. And it has some good antimicrobial effects to kill pathogens without beating up the good guy bacteria. And so it's a really good herb for digestive issues. But I'm actually writing a book right now about trees, medicinal trees. And I've been trying to figure out what the heck to do with the vines, because vines aren't trees. And I have a book about weeds, and they're not weeds. And so, what am I going to do with the vines? And so I'm not going to write a book about medicinal vines, although I probably could. There's a lot of them. But anyway, I decided finally, forget it. The vines climb the trees. We'll put them in the tree book, right? And so I was starting the chapter on hops in the tree book, and I was trying to remember how many M's are in Cumulus. Is there only one M or two M's? And so I Googled it, and there's only one M, in case you need to know things like that. But anyway, as I was looking at the page that had the Latin name on there, it said it was in the Cannabaceae family, which I knew, but I hadn't thought about for years. And I thought, holy cow, hops is in the cannabis family. And immediately I thought, why the heck am I not using that for pain topically? And I had that day this horrible pain in my thumb. We had moved the week before, and I'd runked my thumb moving a couch or some dumb thing. And if I moved my thumb just right, I would get this horrible shooting pain all up my arm, just really sore. And I've been dealing with it for a couple of days. And, I have a really good herbalist that I know, but I can never get a hold of him when I'm sick. It seems like he's always sick when I'm sick. Anyway, he's also easily distracted, and so I can never get his attention long enough to help me with what's going on with me. Anyway, I was, just as I was grabbing something to jot something down, that pain shot screaming up my wrist. And I thought, why am I not using hops for this? And I went into the herb room, to the shipping room, where all the little bottles sit until they're going to go live at somebody else's house. And I grabbed a bottle of hops off the shelf, and I'm slopping it on my hand, And my son-in-law, Davis, who's our facilities manager, and he comes up and says, we got spray bottles for that. So I went to the other shelf and got a little spray bottle to put on the tincture bottle, because that's a really clever idea. And before I could get that lid on to the bottle, because there's hops all over the floor, before I could get that lid on the bottle to make it a spray, the pain was gone. I mean, it wasn't 2 minutes, and it was just gone. And so right away, I roll up my pant legs. My knees had been killing me, and I spray it on my knees, and then they don't hurt anymore, and I'm dancing around trying to make them hurt and wiggling my thumb and dancing around. And everybody's looking at me, oh, now what's Dad doing, But anyway, that's how I discovered hops is good for pain topically, and it's amazing. It's really, really good. And since then, I've used it on all kinds of cases for pain. And it can, it doesn't really matter what kind of pain it is. It seems also, like skullcap, to be particularly good for nerve aggravations. But I've used it on arthritis cases and inflammatory kind of pains and tension pains as well. And so really a great plant. And again, like I said, the strobiles, these little pine cone guys, are the medicine. That's what you want. And you want to harvest those late in the summer or early in the fall. And my daughter, Jenny, who's also helps us a lot with the school, she's a good little herbalist too. Anyway, she also was our customer support gal forever. But anyway, Jenny said you can use it as an alternative to yeast for making bread. So I haven't tried that. Somebody try that and tell me if that works. All right. Let's talk about cloves. Now, usually I have a very strong emphasis on local plants, stuff you can grow, stuff you can go outside and find in the vacant lot next to your house. You know, I really, really think it's a very, very valuable thing to have a focus on locally available plants. And cloves are not locally available unless you live in Indonesia, right? Um, because they're a tropical plant. But they are locally available in almost everybody's kitchen. And so we're going to cheat. And we're going to say this is a sort of a locally available plant, right? But anyway, cloves, and the clove is what you use. These are the little dried up flower bud after the flower seed thingies. That's the technical botanical term. Anyway, they grind these up, and that's what's in your spice cabinet. In fact, every single spice in your spice drawer is a phenomenal medicine. I wonder if it's on YouTube. Is it on YouTube? I've got a video called, in fact, I've got two videos called Kitchen Medicine. I don't know if they're on there or not. If they're not, I'll put them up. Anyway, and they just talk about all the spices. All the spices are good for stuff. And cloves is no exception. But like I say, it's only going to grow in your spice drawer, right? It's not, it's a tropical plant. So unless you have a greenhouse and can, somehow, I don't know, duplicate the conditions of the tropics, you're not going to be growing much cloves. But it might be a really good idea to put a bottle of it in your medicine cabinet, right? So cloves is an anodyne. It's got good antibiotic properties. It's got antiviral, antifungal properties. It stimulates the immune system. It decreases inflammation. But mostly, it's a anodyne. What the heck does that mean? What's an anodyne? Well, an anodyne is the funky herbalist word for a plant that eliminates pain topically on the mucous membranes. So the mucous membranes is your gums, your throat, your stomach, your bladder, anything inside your body, any surface inside your body is a mucous membrane, okay? And so, if you put cloves on your sore joints, it won't work. I have never had it, have a big effect on that. But if let me take that back. It doesn't numb your joints. It does have some effect topically as a painkiller for the inflammation. But the anodyne properties don't seem as powerful through the skin as they do through the mucous membranes, okay? So the thing I use it for most is on the gums for a bad tooth. That's what I use it for. And I got to tell you, my wife, so I married a sweet Idaho farm girl, dearest friend in the whole world. And she's also a professor in the school, in the Homegrown Herbalist school. She's a midwife, and she's a naturopath. We went to naturopath school together. But she's also been a practicing midwife for years. And so she's an herbalist, and she's really great. But anyway, she went to the dentist and got this was years and years ago, and I don't remember what he did to her tooth, but it was some kind of big deal. He had to do this tooth. And, she was all loaded up with Novocaine. And she came home, and about an hour after we got home, the Novocaine wore off, and she was really, really in bad shape. I mean, she was so sore. And she's tough. She has a very high pain threshold. And for her to be that uncomfortable, I thought, wow, that must really, really hurt. So I called the dentist. He's a buddy of mine. I called him up. I says, hey, Lori's in big trouble here. The Novocaine wore off, and she's really in a lot of pain. And he says, oh, give her some Advil. And he said, give her half a bottle. I don't remember how much it was, but this was enormously high number of milligrams of Advil that he thought we ought to give her. And I thought, I think we won't do that. I think that if I did that, I'd have to give her something for her ulcer next week. Uh, so I went out to the herb room and I got some cloves tincture, and I got some little cotton balls, and I put a little bit of cloves on some cotton, and she poked it up next to that sore tooth, and boom, done. Numb, right? Couldn't feel it at all. And she had to do that every half hour, every 40 minutes, to keep it behaving. But she got through that first day, and the second day she was okay, right? And in addition to killing it, numbing the nerves, killing the pain, it has anti-inflammatory properties. It has antimicrobial properties. There wasn't nothing going to grow in that mouth and infect that tooth either, so that's good too. So a couple of things. The cloves are better if you don't grind them up. Okay, so whole cloves will retain their medicinal properties much, much longer and be much stronger than powdered cloves. You can powder them to use them. If you're going to make the tincture, powder them. But if you're going to store them for a little while, don't powder them. So I would grind them immediately when you're going to use them. If you're going to use the essential oil of cloves, make sure you dilute it. I'm not talking about using essential oils in this lecture. Okay, I'm talking about using tinctures and the plants themselves and teas. If you're going to actually use the essential oil, make sure you dilute it with a carrier oil, because it's really strong and it can over irritate your tissues. But what I've always done is just use tinctures. That's what I do. And so, yeah, cloves are really great. Really great as an anodyne for topical pain, especially like dental pain. That's mostly what I use it for. Okay, here's the next one. This is teasel. Dipsacus is the genus, and there's several different species, and we don't care which species we use. Whenever you see this is the Latin name, right? Dipsacus. Dipsacus is the genus, and then the species would be Phalorum or Sylvestris, or, there's a lot of different species. But if you ever see this SPP after a genus names, it just means species, right? Everybody, all the guys in that genus are fine. And so that's just a taxonomic shortcut to saying this genus and all her kids. That's what we're after. So it has several names. They call it Fuller's teasel or carding teasel. The Chinese name is Zhuduan, if you're keeping notes on Chinese names of things. We'll talk about that in a minute, actually. But they call it teasel, and they call it Fuller's teasel or carder's teasel because they used to card wool with it. Or, teasel is for teasing wool, for combing wool. Okay. And they actually used to make, felt with it, and they used to card wool with it. They used to make big machines. I should have put a picture on here. I have a picture from an old museum in England of a big machine that was made out of teasel heads. They took these heads and made this giant brush for combing wool and carding wool. Anyway, it's a very cool plant. They use it a lot in, ornamental flower arrangement, fun things too. So, by the way, this weed down here is not teasel. The leaves here are not teasel. I don't know what that is. The heads is what we're looking at. Okay, so the root's the medicine. And teasel is an interesting plant. I got introduced to teasel in sort of an interesting way. I was driving down the road with a buddy of mine who's a plant scientist. He runs some greenhouses down locally here, great guy. And we're driving along the road, and I saw teasel in the ditch bank growing. I had no idea what it was. I don't know that I'd ever noticed it before. I saw this plant. I had this extraordinarily strong impression. You need to get to know that plant. That's a really important plant. And I'm like, holy cow, what's that about? And I asked Fred, I says, what's that plant out there? He says, I don't know what it is. And so I thought, that's really weird. And so about a week later, I saw it again. I was at the property of Stephen that worked with me at the time. And he's a pretty good herbalist, and he knows a lot about plants. And I had that same feeling, that intense impression. Holy cow, I have got to learn this plant. It's a really important plant. And I says, what is that? And he says, it's teasel. I says, well, what's it good for? He says, I don't know that it's good for anything. I says, no, it's really good for something. I dug up the roots that day, knowing nothing about it. Dug up the roots and started a tincture, right? And then I got out all my old dusty herb books and start digging. And sure enough, Teasel's a medicinal plant. Nobody uses it anymore. They're using it. They're starting to use it a lot for Lyme's disease. It's very good for Lyme's disease. But it's just sort of like, bell bottoms and love beads. Nobody's doing it right now. But they will soon. But anyway, the Chinese have been using it forever. And the Chinese name is Zhu Duan. And Zhu Duan means, and I my apologies to anybody that actually speaks Chinese, okay? I have disclaimer, I have no idea how to pronounce Chinese words. But Zhu Duan means restore that which is broken. And the Chinese used it on broken bones and wounds and stuff, which I've never done. But I'll tell you, there's something about that name that also relates in my mind to what it does with pain. Because Teasel, so here's the story, right? I'm tincturing this stuff that I don't know what the heck it is. I'm reading my books and learning and studying for a couple of weeks while it's percolating, right? Macerating. And the day I was pressing the tincture, literally the day I was pressing the tincture, this lady walks in. She says, Doc, I've got this weird nerve pain, right? I was in an accident years ago. I have all this nerve entrapment and I have this horrible pain and nothing helps. Do you have anything for weird nerve pain? And that was one of the main thing that my old dusty book said it was good for. It was weird nerve pain, right? And I says, wow, maybe I do, right? As I'm pressing the tincture, maybe I do. Bottled some up and gave it to her. She took it for about a week and the pain was gone forever. This pain she'd had for 20 years probably. Just gone, done, right? And I've used it on, since then, a number of other cases that had chronic pain from something that happened forever ago, And in a lot of those cases, it just makes the pain go away. It restores what was broken. Sometimes a nerve gets aggravated and irritated. It has some big trauma in its life. You get hit by a car or something, and the nerve is so traumatized that it decides that its new job is to remind you all day, every day that you got hit by a car 20 years ago because that was bad. Don't do that again, right? But nothing active is going on. There's no inflammation. There's nothing's going on. It's just that nerve is stuck on that idea, right? It's sort of like when your computer freezes up and it's stuck and it won't do anything else. And what do? Well, you turn it off and you turn it back on and reboot the computer. And I think, in my experience anyway, that's what Teasel does. It reboots the computer. It says, look, what are you doing? Don't you remember your job? Your job isn't to scream about a car accident that happened 20 years ago all day, every day. Your job is to tell us what the weather's like out. Is it cold or is it hot? And, what do the curtains feel like? And is that pan warm? And, you have all kinds of important jobs. Forget about the car wreck. It's not happening today, right? And in a lot of those chronic, unrelenting pain cases, the Teasel just knocks it right out and it never comes back. And, most people take it for, a week for that to happen. It's not like you take one dose and it is over. But for a lot of those chronic cases, it really helps. Now, it also helps active pain things. If you wrench your back and it hurts because it hurts, it's because it's inflamed and spasming and mad and everything, Teasel helps that too. But you'll have to do it again in 4 hours because you have an active process going on, right? But anyway, so it's good for both. And I mostly use it topically for those kinds of incidents. And it works really good for the active stuff. But for the long-term and chronic stuff, I do both. I do topical and internal. And it oftentimes is very effective. I'll tell you, it's also, I've only ever treated one serious Lyme's case in my life because I don't live somewhere where there's any Lyme's. This gal went to Wisconsin and got it. But I met her the same week that I met the other lady when I'm pressing this Teasel tincture, right? And she had serious advanced Lyme's disease. She was having neurologic stuff and having seizures all day. And anyway, I put her on Teasel, and I put her on a number of other things too. But I put her on Teasel, and she got markedly better, stopped having the seizures. Um, in fact, I talked to her about 2 weeks after we started the protocol, and I says, "How you doing?" And she says, "I don't have seizures anymore." And she was having 8 or 10 seizures a day. Like, she didn't go anywhere unless her mom was on her arm. She was in her 20s. She didn't go anywhere without somebody holding on to her because she might have a seizure and bust her head, you know? And so, anyway, she says, I never have seizures except late at night. I'll have one sometimes, like in the middle of the night. I thought, wow, that's great. I just take some Teasel right before you go to bed because apparently it's not lasting, 12 hours. And she started doing that and then didn't have seizures hardly at all anymore. But anyway, this was years ago, and she's markedly better. It's not perfect. It doesn't, it didn't completely eradicate all the devastating effects of having had Lyme's disease for many, many years. But she's way better than she was, The other thing that I've used Teasel for, and it's another pain thing, sort of, is MS. And again, the same week that I got that Teasel pressed, I had the lady with the bad back, the Lyme's case, and then about within a week or two of that tincture being ready, I was down at a conference in Utah, and this sweet young gal comes up and says, "Do you have anything for MS?" And I started to say, "No, I don't really. I have never dealt with an MS case, and I'm a veterinarian. We don't even see MS in the dog community." And I started explaining to her why I wasn't of any use at all. And in the back of my head, I hear it loud as loud, "Nerve pain." I'm like, oh, maybe I do. And I says, "Take this and see what happens." And she says, "How do I do it?" And I was just about to tell her what I'd been telling everybody. Oh, I don't know, do a teaspoon a couple of times a day, half a teaspoon a couple of times a day, right? But with her, I started to say that, and I got this wet blanket, and I said, "I don't know." I said, and then all of a sudden, I said, "This is what I want you to do. I want you to take 1 drop 3 times a day of the tincture. And the next day, I want you to do 2 drops 3 times a day, and then 3 drops 3 times a day. And if you get to 30 or 40 drops three times a day, call me. We don't want you taking too much. But I want you to go up incrementally like that." I had no idea why I'd said that. I'd never said anything like that to anybody. Never heard of anything like that. Right? But anyway, about 2 weeks later, she sends me an email. She says, "Doc, you have got to send me a picture of this plant." She says, "When I hit 14 drops 3 times a day, it's like somebody flipped a switch, and I feel pretty good. And I used to 2 or 3 days a week be so bad my husband had to carry me to the shower, and I feel pretty good." And like a year later, I was actually telling this story. I was up in the hills on a plant walk with a bunch of people, right? Tromping around in the mountains. And this little gal in the front row raised her head and says, "It was me," right? So here's this sweet gal who had MS tromping around in the hills with us, feeling pretty good. She was off almost all of her meds. She was off all the pain meds, and she was doing pretty good on the Teasel. And since then, I've used Teasel on 4 other MS cases. I don't see a lot of MS cases, okay? But I've had 4 other cases, 2 of whom were, one was the mother of a son-in-law, and the other, in fact, they were both mothers of son-in-law, 2 of them, 2 different sons-in-law. Anyway, those 2, and then 2 other people, all of them had pretty significant MS, and every single one of those people has said, "Wow, the Teasel really, really helps." And every one of their doctors has said, "I don't know what the heck you're doing, but you're way better off than you ought to be at this point. I mean, I don't know why you're still walking around and feeling good and able to do anything at this point." And so Teasel is doing something in MS cases to decrease the damage to the nerves or something. I don't know what it's doing. Somebody needs to do a study on it and see what the heck it's doing. But I can tell you, and 5 people is not a statistically significant sample. I know that, right? I mean, that's nothing. But I'll tell you what, when the sixth guy comes along, he's getting some teasel too, because it's worked amazingly well for everybody I've done it with. Okay. So anyway, teasel. So how do you use it? Well, first of all, it's a biennial plant. All right. It's a biennial plant. The root's the medicine. And so you want to harvest the roots either at the end of the first year or better yet, in the spring of the second year before they bolt up to flower, seed, and die. So a biennial plant is a plant that has a 2-year cycle. So the first year it just does this low leafy thing. The second year it bolts up, flower, seeds, and dies. Okay. And so the roots, the medicine, and so you want the roots when they're as big as possible, but you also want them before the thing bolts up to flower, because once it does that, it's pulling everything out of the roots, because it's never going to need those again, right? So the time to harvest that is either late fall of the first year or in the spring of the second year before it shoots up to flower. And the way you find it is, you look for these guys. These are the old dead grandmas. You don't want their roots, right? They're not even alive anymore. But if you look at their feet, you'll see these guys, the first year plants. They've got these wrinkly leaves, and on the back of the leaf, there's, the big major vein on the back of the leaf has little spines all along it too. Okay. So there's a tradition in herbalism called the law of signatures. And the law of signatures says that plants have clues on them, right? That God put all kinds of little hints on the plants, right? So yellow things are good for your liver because bile is yellow. Red things are good for circulation. Mullein flowers look like, mullein leaves look like lungs, all these things. And look at this plant. What is she saying? Look at the anatomy, the morphology of that plant. What's it saying? It's saying, I hurt everywhere, right? So anyway, it's good for pain. All right. So, like I say, you can use it internally. You can use it topically. Really a great plant. And incidentally, going back to that first MS case, I read months later in a book, an old dusty herb text, that some people can have a reaction to teasel. They can have a reaction where they get a rash, right? And it's not a big deal, but it's no fun. And so this author said, what I do is I have people start very, very small doses, like 1 drop 3 times a day, and then 2 drops 3 times a day. Literally, is what he said. I'm not kidding. 4 drops 3 times a day, 5 drops 3 times a day. And if they do that, they don't get the rash. So, take home message. It's very, very important to listen to that inner voice. If you're driving down the road and the spirit says, you really need to learn about that plant. Gee, maybe you ought to. If you're talking to somebody and that inner voice says, start slow with this one. Just do 1 drop 3 times a day to start. Maybe you ought to listen. All right. So let's talk about our next friend. This is Cramp Bark, Viburnum opulus, the snowball bush, right? In Great Britain, they call it a Gelder rose. I like saying that. That's fun. I don't know what it means. Gelder rose, that's fun. Swamp elder, water elder. They call it European cranberry because it makes berries. But this is a very, very common plant. This is not hydrangea. Okay, if you're living on the East Coast and you're seeing this, you're thinking, oh, I bet that's a hydrangea. I've got one of those in my yard. No, you don't have one of those in your yard. This is Cramp Bark, Viburnum opulus. Completely different critter. From a distance, it kind of looks hydrangea, but if you get up close, it's a completely different looking thing. But they usually call it a snowball bush. So, all right, let's talk about it. Cramp bark is, it's a shrub, and here's the berries I was talking about. And these berries they're edible. But only in the very strictest sense. Edible in the sense that you can put them in your mouth and swallow them and they won't hurt you. But they don't taste good, all right? So don't do it. Okay, anyway, it's a very popular ornamental. It likes sun, it likes light shade, doesn't care. likes the dirt to be kind of alkaline, which is a good reason to live in the western states. Um, it's easy to propagate. You can just cut little sticks off and stick them in some dirt in a bag, and it'll root pretty good. But the inner bark's the medicine. And whenever you read in an herb book that the bark's the medicine, they're almost without exception talking about the inner bark, the cambium, right? Now this plant, the bark is so thin, I don't bother pulling the outer bark off the inner bark. Just take all of it. But you want to make sure you're getting that green, thick underlayer. That's the part that matters. Okay. The outer bark on this is really thin and brown and scrubby, and it doesn't matter. There's not enough of it there to affect your medicine, but there's enough of it there to affect what you're going to do all day. So don't bother. Try to separate it. And you want to harvest the bark in the spring before the plant flowers. Okay. And but these are big, shrubby, bushy guys. They get a little out of control. You gotta trim them anyway. So in the spring, you go out and you cut a bunch of canes, and you haul them into the house and cut the bark off and pull it off and let it dry for several weeks, probably about 3 weeks to get it really dry. And then that's your cramp bark for the year, right? Make a tincture, make a tea, do whatever you want with it. So, and this is one that was grown in my yard. They've been using this forever. Native Americans have been using this for as long as Native Americans have been in North America. And the American colonists used it too. I guess they were British colonists technically until they became Americans. But anyway, it's an antispasmodic. Okay. And so what does that mean? Well, it means it resolves muscle spasms, right? Turns off muscle spasms. And so a lot of pain happens because of muscle contracture. Like if you pop a nerve in your back, I've got this rib that pops out once in a while. And the rib popping out isn't a big deal. But what happens immediately after is all the muscles in my back cramp up and spasm because that really hurt and we don't want him to ever move again. Your body's making a splint to hold you still because something bad happened, right? And the splint hurts worse than the injury. The muscle cramps hurt worse than the injury. And so, using an anti-cramping herb, an antispasmodic herb like cramp bark or lobelia, there's a lot of them. But anyway, relaxes those muscles so they can unwind. So it's an antispasmodic. It has some very, very, very mild sedative properties, not enough that you'll even hardly notice. But it's a little calming, and I think that's more to do with muscle relaxation than with neurologic sedation. A skull cap will knock you out. It'll help you get to sleep at night. Cramp bark just relaxes everything. It's more of a more anatomical and physiological than psychological. Okay. But it's antispasmodic. It's hypotensive, which means it is good for lowering blood pressure. And why is that? Well, it's the same thing. It's a one-trick pony, right? It's just relaxing tissue. Okay. So if you relax tissue, guess what? Your blood pressure drops, right? Because everything's relaxed. Your blood vessels are surrounded by muscle. The arteries are anyway. And so if you relax everything, well, then the pressure is going to go down. Okay. It's also very good for improving circulation. It's a vasodilator, right? Same thing. It's just relaxing it. It's also, I use it in kidney stone formulas. Well, what does that come to? Well, guess what? The pipes that the stones have to go through to get out are surrounded by muscles. The ureters between the kidney and the bladder and the urethra between the bladder and the outside world, they're muscular tubes. And so if you can relax those, oh, isn't that nice? Now the rock can get through easier, okay? Because those muscles, their job is to squeeze things and push them through. And if it won't go through, what do? All they know how to do is squeeze things, so they squeeze harder, right? And so if you relax them, that stone can move better. And certainly I give other herbs too for that. I mean, I give them, herbs to make them increase urination. I give them herbs to dissolve the rock. That's handy. But the muscle relaxant's a good idea too. So, back pain, neck pain, muscle spasms, uterine cramps. This is, interestingly, one of the few plants that's good for uterine cramps that's also safe to give during pregnancy. Most plants that impact uterine contraction do it hormonally, And so there's a lot of plants that are good for menstrual cramps because they do things to estrogen levels and progesterone levels, and it relaxes. It tells everybody to, enough is enough, and things relax. Cramp bark, like I said, it just relaxes muscles. Nothing to do with hormones. And so, you don't want to use an herb that relaxes the uterus through hormonal management during pregnancy, because you don't want to monkey with the hormones if somebody's living in there, right? That could be a bad idea. But you can use cramp bark during pregnancy. You can use it for preterm labor, And so that's also a benefit. You can use it internally or topically. And I'll tell you, let me give you an example of cramp bark. So I had brain surgery about a year ago. Okay, I was growing this fun, big old Vienna sausage in my head just for fun. And it wasn't cancer or anything, but it was squishing my optic nerve. And in fact, that's why I went in to see what the heck was going on, because I was starting to have some visual disturbances in my left eye. And they couldn't find anything wrong with my eye, and so they did an MRI. And they said, oh, it's because you got this big sausage growing in your brain and squishing your optic nerve. And they took it out. So I was in the hospital for a couple of weeks. I was in the brain surgery ICU for about a week, and then they moved into the regular, some other place for about a week. Anyway, because they like to watch you after they puddle around in your brain for 9 hours. Anyway, when I left the hospital, I had very little pain from the surgery, almost nothing. I think I took some Tylenol the first day, but they wouldn't let me take anything stronger than that because they wanted to make sure my brain worked. They came in every half hour and asked me my name and if I knew what day it was. And I never did know what day it was. And so they knew I was fine because I never knew what day it was before I had surgery. But anyway, 2 weeks later, I'm going home and I could hardly walk. I was in so much pain from two things. Number one, I would guess I was on a hospital bed for 9 hours in who knows what kind of position. And then I was in these other awful hospital beds for 2 weeks, and my sacrum was just completely ranked and mad, right? And so my wife got me home, and she's a naturopath, right? And she tossed me on the massage table, and what did she do? She took some cramp bark and some skullcap and some valerian and some chamomile. I have a formula called Rest Easy that's got skullcap, valerian, and chamomile. She used that, and then she used a formula called Nomospasms, which is cramp bark and lobelia and some other guys, antispasmodics. So she used nervine painkillers to tell the nerves, quit screaming because you're getting pinched. And she used muscle relaxants like cramp bark and lobelia to tell the muscles, all right, guys, relax, right? And I immediately felt some relief. And she was spraying those on topically, alcohol tinctures of the herb sprayed on topically, right, on my sacrum. She let it sit for a minute. I started feeling a little better just from the nervines and the antispasmodics. And by the way, she gave me both of those internally as well. So I was getting them internally and topically. And then she, because everything was relaxed, was able to very easily relocate that sacrum using a modality called naturopathy, which we practice, which is, anyway, that's a whole other lecture, naturopathy school. Anyway, naturopathy is sort of a child of chiropractic. It was developed by one of the disciples of D.D. Palmer, who invented chiropractic. But naturopathy, instead of using abrupt concussive movements to pop things into place, it uses, it does ligament work, and it readjusts things by manipulating and working and fatiguing the ligaments, not by popping the bones around. Anyway, naturopathy is cool. Anyway, so she got and she also used vibration. We had a Resimax tuner, And she used that to relax some muscles and get some nerves to quit screaming. Anyway, 20 minutes later, I was completely resolved. I mean, I was walking around like nothing happened. So, these herbs and these other modalities too, but certainly the herbs, the antispasmodics and nervines, were phenomenally beneficial in that case. And like I said, you can use cramp bark topically as a tincture, or you can use it internally. It works both ways. Okay, willow. Let's talk about willow. And willow is a big group. I mean, there's a lot of willows. Salix is the genus, and I don't care which one it is. Use whichever one you want. And the bark is the medicine. And again, it's the inner bark, but don't even bother with the inner bark. The willow tree has this thick, hard, tough brown tree bark all over it. And you're not going to get into the inner bark without some pretty serious work. And so what you do is you just use the green bendy bark on the young branches, right? And the outer bark on the green bendy bark is so thin, again, like cramp bark, don't bother taking it off. Just take all of it. Take all the bark off the thing. Take everything that'll come off of that stick, and that's the bark you want. But it's the inner cambium, the thick layer is what you want. The outer green layer is so thin you can hardly see it, so don't worry about that. So here's some big old weeping willow trees. The green bark's what you want. These trees are easy to grow. You can cut a willow branch off and stick it in a bucket of water and it'll root in a couple of weeks. They're super easy to grow from cuttings. You can use the bark whenever you want. It's a little better in the spring, a little more potent in the spring, but you can use it whenever you want. And it's basically aspirin on a stick. It has a lot of salicylic acid in it, salicylates, which is what aspirin's made of. Aspirin was made from plants. They invented aspirin from the spirea plant, which is almost identical to willow medicinally. And the word aspirin is aspirea, out of spirea. I mean, that's where it came from. A lot of our pharmaceuticals have had their origins in medicinal plants. So use it like aspirin. It's good for pain. It's good for fevers. It's good for inflammation, right? It's good for arthritis, any kind of pain, really. You can use it internally as a tea or as a tincture. That's how I've always used it. I've never used it topically, and I don't know why, but I just never have. I've heard that you can use it topically. I've also heard that a few people get kind of irritated if they use it topically, but I guess I need to try it as a tincture topically. I like tinctures topically better than anything else. And the reason I like that is because the alcohol in the tincture helps them be more penetrating, I think, and so plus it's clean, you spray it on and in a minute it evaporates and the alcohol goes away, but the herbs are still there and they've gone in and done their thing. But I got to tell you, I think every plant we've talked about today can be used topically as a tincture. And that is a technique that is vastly underused in herbal medicine. Vastly underused. And I've been doing a ton of it the last several years and just loving it. I mean, topical tinctures, particularly for pain and muscle relaxation, are astoundingly good. And if you've got somebody that's got a lot of pain and they're on pharmaceuticals, well, mixing drugs and herbs is a pretty bad idea a lot of the time, right? Because they can have sometimes they interfere with each other. Sometimes they don't interfere with each other and it's great and no big deal. Sometimes they augment each other, and that could either be a very good thing or a very bad thing. If you're taking an herb, a pharmaceutical to lower your blood pressure, and you add an herb to lower your blood pressure, well, now what? Now you got really low blood pressure. Or if you're taking a pharmaceutical to lower blood sugar and you take an herb to lower blood sugar, well, now you're hypoglycemic, and so you can combine herbs and drugs in many cases, but you dang well better know what you're doing. You probably ought to be talking to somebody that understands both of them. And so the nice thing about topical tinctures is you don't have that problem. They don't affect and interact with the drugs on anywhere near the same level as they do if you take them internally. And so if you have somebody that has a lot of pain and they're on half a dozen pharmaceuticals because they have cancer or who knows what, use the tinctures topically. Give them some skullcap, give them some hops topically, spray it on, you know, put the tincture on topically. And then you don't have to worry about all the inner conflicts between the pharmaceuticals and the herbs. Really, really an important principle. And herbalists need to be doing more of that and thinking more and talking more about it. Okay, here's another one. This is white sage, Salvia apiana. And this is a cousin. Salvia is in the mint family. And it's a cousin of the sage that you stuff your turkey with, right? It grows in California, Southern California, the Baja Peninsula, Mexican West Coast, places like that. So it's kind of a sissy when it comes to temperature. I don't think it would grow in Indiana, but it's way better for pain than its cousin, Salvia officinalis, which is, garden sage, the spice, which is an amazing herb. I mean, I'm not going to beat up on regular sage because it's an outstanding herb for a lot of the same things this is good for, but it's not as good for pain. This is a rock star for pain. Okay. And I was introduced to this herb by a friend of mine, Jeff Mitzel, who's a good herbalist. And Jeff does a lot of stuff with pain, really helps a lot of people. Anyway, I was having some pain in my back. I was having a back thing. And he went to his car and says, here, try this on it. And it was white sage tincture. And actually it was white sage and sagebrush, Artemisia tridentata together. And they're both called sage, but they have no relationship at all. Sagebrush is Artemisia, it's a different genus. White sage is Salvia. But they both smell like sage, so they both got called sage. But anyway, white sage is a really good medicine for a lot of things. The aerial parts of the medicine, just like all the mints. It's a mint, right? It likes full sun, it likes well-draining soil, and it likes warm temperatures. If it freezes, you probably won't overwinter, okay? It's best to harvest it when it flowers. Harvest it before the flowers open up. Harvest it, and then you just cut off the top third or a quarter of the plant. Let it dry for a couple of weeks, and you're all set. Okay. So what's it good for? Well, it's good for about everything. It's like its cousin, Salvia officinalis, regular sage, turkey stuffing sage. They're antibacterial. They're anti-inflammatory. They're good for fevers. They're antifungal. They're great astringents. The sages are phenomenal for diarrhea, dysentery, but they're also good because they're astringents for sore throats, for gingivitis, for gum disease, for inflammations in your throat and your guts. Really, really great. Really good for gut stuff. And whether that's diarrhea because of the astringency, it's good, but it's also good because it's a mint, and all the mints like to do something to your nerves, right? And this one loves to do something to your nerves, and so it calms the gut too. It calms inflammations and nerve pain in the gut too. So that's good for GI stuff. And it has some anti-inflammatory properties, which is great. And it also binds with the cannabinoid receptors, which are the same ones that hops bound with, right? And that marijuana binds with. It doesn't make you high. Don't bother trying to do that. But it does make you not hurt the same way marijuana does. And marijuana is phenomenal for making things not hurt. And so, as CBD oil is pretty good. But I don't think CBD oil is better than this or hops, personally. Anyway, we're not going to get into that. CBD oil in Idaho is illegal. Federally, it's legal. Marijuana is legal medically in a lot of states, but federally, it's illegal. So I don't use anything that's illegal, and I don't care who thinks it's illegal. Okay. But the good news is you don't have to, because you can use hops or any of the other guys we've talked about today But you could use hops and white sage and get exactly the same effect for the pain stuff. So you don't even have to use legalized anything or illegal anything. All right. So anyway, um, really, really good internally or topically for pain. All right. And I think, I'm trying to think if I've ever used it internally. I think I've always used it topically. This one. I've used the other sage internally for all the other things it does. I only ever use this for pain. Um, and I've only used it topically as a tincture, just spray it on, and it works amazingly well. But you can use it internally just like its cousin. They're both salvias. They do the same thing. This one does have a little more thujone in it than regular salvia. And thujone is not something you want to take long term internally. You can spray it on yourself all you want. It never hurts you. Okay. But internally, long term thujone is probably a bad idea. So I wouldn't take this, like if I had pain, this isn't the herb that I would choose to deal with it chronically for the rest of my life internally. It is one I would probably use topically for the rest of my life, right? But anyway, just be aware of that. All right, and again, it's the aerial parts of the plant, leaf and stem, anything above the ground. When it starts to flower, harvest the top third. Okay, this is another great quote. This is from Helen Keller. She says, although the world is full of suffering, it's also full of the overcoming of it. And you know, isn't that the truth? I mean, you look at these plants, and we've only talked about 7. We're having a live workshop. The Homegrown Herbalist School is having a live workshop here in Idaho in sometime in June. Go to homegrownherbalist.net and click on events. You can see when we're doing live stuff. But anyway, we're doing that workshop, and we'll be talking about dozens and dozens of herbs for pain and how they work and how to use them and which is best for this and that and the other thing. You know, we're not even scratching the surface here on this thing. You know, we just talked about 7, and we just sort of ice skated over 7. You know, if you want to really, really dig into some things, that event will be remarkable. Or join the Homegrown Herbalist School. You know, where we do some ice fishing and not just ice skating. We get into way more depth and way more detail, and way more cases and way more, you know, because like I said, I'm a veterinarian and a naturopath. We do this stuff all day, every day. And so we have a lot of case studies and a lot of things. But anyway, we would encourage you to swing by homegrownherbalist.net. We also have there, just coincidentally, a pain kit with a lot of these herbs are in it that are good for things. So you might have a look at that. Just go to homegrownherbalist.net. We have a lot of blog articles there you might enjoy, and a lot of other resources. So, and certainly you can learn about the school. So anyway, I hope you've enjoyed this. I hope you learned something. If you did, share it with your friends. We sure appreciate that. Click that like button. Click that subscribe button. If you have a question, put it in the comments. I answer about everything. Sometimes it takes me a couple of weeks to remember that I need to do that, but put it on there. We'll get to it. Anyway, this is Dr. Patrick Jones from the Homegrown Herbalist School of Botanical Medicine, and thanks for watching.